My name is Harriet, and I'm a second-year physical therapy student. I am here to present you with a student's perspective of how I utilize this to understand better the anatomy of the foot. I mean, I'm sure for anyone who's first learned about the foot, it can be quite complex in terms of its kinematics, its ligaments, and its muscle layers. So what we did, I'm going to put on the PowerPoint really quickly in the background. At first, to be perfectly honest, I am definitely a visual learner, and I like lectures, and I didn't know would I really feel like I could benefit from this tool. But then I was given this opportunity, so I practiced doing this. And what I found was that, we've all heard the term like nerves that fire wire together. And that's exactly what I felt when I actually had to look at the precise locations on the anatomy, when I had to think about the fiber orientation and how that would affect the ligament tears, the ankle sprains. I felt like I could have a better understanding of how the ligaments are strained in certain positions, how I could better remember that for tests. And beyond that, I also felt that when we look at the musculature of the foot, which can be quite complex for first-time learners, it forms several layers. We all remember this from our first anatomy class. It was quite difficult as students. All of us, we would complain about, I can't remember this. I don't know, how do I remember all the functions of the muscles? And what was really good about using this tool was that I'd really have to look at, all right, where's my insertion point? Where are my origins? And once you remember where that muscle inserts, you know its function. For example, for the abductor hallucis, we know that if it inserts proximal to that joint, it's going to flex it. We know based on its orientation that's going to abduct it. And that's one of the most powerful things I felt. When I just read a journal article, I may forget about it. But when I write that research paper myself, I tend to remember it very well. So I felt that this was the opportunity to make me the creator of the muscles, of the ligaments that I want to really memorize and learn for my clinical applications. So I'm going to be showing you how I use this as a tool, and we can all practice along with doing the ligaments and doing the muscles. Okay, so the first one we're going to be talking about is the lateral ligaments. All familiar with the lateral ligaments, right? Should I do a quick review? Yeah? Okay. So I'm sure we've all had a lateral ankle sprain. It's very common in sports and even just when you have muscular instability in your lower leg. So the one that's the most commonly injured, which we'll be drawing first, is named the anterior talofibular ligament. Like its name suggests, it runs from the anterior aspect of the fibula, and it inserts onto the talus, which would be the bone right here. Okay, this is the most commonly injured ligament in ankle sprains where you just roll your foot inwards. It's often the result of, say, a basketball injury. A basketball player is jumping up, he lands with his foot like this, he could trip, and then he rolls his foot. Okay, so that's the first one we'll be talking about or drawing together. Then there's other parts to it, which is the calcaneofibular ligament. It drops down from the fibula down to the calcaneus, and finally the posterior fibular ligament, going from the posterior aspect of the fibula backwards to the talus, posterior talofibular. Okay, so should we draw that all together first? I am going to grab my pen. And so what is the most important as students is for us to really understand that fiber orientation, because that determines the type of stresses that causes injury. So have you guys all tried practicing drawing in 3D? Drawing 3D? Yeah, okay, thank you. Okay. Okay.
By the way, this uses the same filament that we use in our big printers. So it comes with those little tiny packages, but we've got big giant rolls of it. So we don't have to worry about using up a lot of material. We use as much as you want.
Can you print from a CT scan?
The question was, can we print from a CT scan? And we have. Yep, and it takes some cleanup. I basically need the DICOM files, and I can work from those.
Okay. All right. So while we draw these ligaments and practice how it can be used for this type of setting with students, I also like to point out how the model itself also serves as a really useful educational tool. If you will notice that, for example, at the first joint, we can see the kinematic structures, the articulating surfaces. One's concave, one's convex. That's, in PT, that's very important because that determines our types of joint mobilizations, how we treat that surface. So I think as a student, to be able to just observe closely what the joints look like is actually a very powerful learning tool. Okay, so let's start with that ligament. We're going to be dropping from the fibula down towards the talus in an oblique fashion. I found that when drawing ligaments in this manner, it's best to have your speed quite high so that it can lay a thick filament down.
Now, the first tests we did with these were just with the bones as they come off the printer, and it makes it bonds to it. Then we coated them, and it seems like if you make a mistake, that you can peel it off a little better, or later we can peel these off and reuse them. We haven't fully tested it yet, but in just some brief tests, it looks like that coating is going to be helpful for us. Also makes the toes stronger; they don't break as easy.
Okay, has everyone finished their 3 ligaments? The anterior talofibular tibial calcaneal and the posterior tibial fibular. Okay, so, all right. Posterior. So these 3 ligaments are injured in different grades of inversion sprains. Next, we may have all heard of something called a high ankle sprain. Have you guys heard of that? High ankle sprain? Yes? Okay.
Obviously not.
Oh, okay, you're just the most obvious. A high ankle sprain, when a patient comes in and it's been longer than you'd expect, and they're no longer having pain in this lower aspect, but yet they're still reporting like instability, sometimes you can suspect it of a high ankle sprain. So what is a high ankle sprain? First, we can draw out the ligaments involved. They are the ligaments between the tibia and the fibula. There is one in the front, and it is right here, the top one. And then there's another one that mirrors it in appearance going in the back. There's also the interosseous membrane between the 2 bones. And for example, if someone's playing football and they get into a tackle and their foot is violently rotated outwards, you can imagine how this bone forces the tibia and the fibula apart, tearing these ligaments. So that's another ligament that we have a lot of clinical applications with and that we must learn. So I'm going to go ahead and fill that in also. Okay, and I'm going to mirror that in the back. In the back, it actually looks a little bit more like a D. So you can draw it, you can fan it out. The ligaments that we're filling in right now are called the anterior and posterior tibiofibular ligaments. So I'm sorry, I didn't label this in the PowerPoint, but it'd be this one right here. So that is involved in the high ankle sprain. Okay?
There's even some experimenting going on now with using a very similar type of device to print with like a T cell type of deal or a cultured cell, and to print that material onto living bone tissue for regeneration. So there's
Like a stem cell spinner?
right. Yes. Yes. And not T cells, stem cell. Yes, yes. And they're 3D printing not only plastic, but they can 3D print titanium, so they can do replacement hip parts or things like that are permanent, can be a permanent portion of the body.
And all this is done sterilely, or can you material itself that is used for surgical implants, how is controlled regarding tissue rejection or tissue reaction to?
Well, actually, I kind of had the same question recently, and
that was
now
very
I
nice.
talked to Dr. Lee, who's in the dentistry there, and he was saying because we have our new printer is actually going to be printing from a resin, more of a fluid, and then lasers hit it, and that's what makes it harden. So it's a lot more accurate, and because if for dental appliances, you don't want something rough that your tongue is touching and feeling. And so I asked him, do I have to print this in a sterile environment? And he says, you basically, the process is that you print it, and then they sterilize it.
But materials that is used, titanium, I guess, has a say, but how is with the other materials?
I think some may have to be printed in a clean room. Others,
Talking about the materials there, that
Yeah.
would change the color.
Yes.
The titanium is something else.
If you want to change the color, you press this, and it's gonna push it back.
yeah,
up.
you wouldn't do a plastic like that, but I mean those materials are being developed or have been developed. But there's a bioprinting place down in San Diego that's creating materials,
And
then
just press this to load the new one in.
Australia is very, very big. They're doing a lot of things, and they're actually the instructor that I took some 3 bioprinting classes with. It was a series of 5, and he actually dropped out because he has an invention now where they're using a pen very similar to that, and doing some surgical, skin or so like you can print.
We're gonna be drawing some muscles.
For burn victims, they're talking about printing layers of skin that match
we're gonna
the
be changing
contour
colors.
of the person.
So you could get
There's a
more.
lot of things that they're bioprinting experimenting with now.
Do you guys want to try drawing muscles now? Felt like you got hang of drawing the ligaments? Okay. So we're going to be moving on to the intrinsic muscles of the foot. These are sometimes overlooked or glanced over. However, they are very important for fine control of your foot, for balancing. And they also support the arch of your foot. So like, for example, if people have flat feet, these muscles are quite important in supporting that arch. So it's quite important that we also learn about the innervations, the origins, and insertions. And that's really good for practicing knowing where the muscles go and where they start. So we can just start with with this one right here. This is the second layer of the foot. These muscles, they flex the toes and extend the tips of the toes. So they flex they flex and extend the toes at different joints. This is the Quadratus Plantae. this muscle assists the long flexors of the toes. So this is the second layer, and we're going to try practicing drawing this long tendon and the muscles. So what I suggest, and this is what I did, is that you can actually start by making a flat skeleton on paper. Does that make sense? You can, I mean, like, it's up to you how you prefer. You can draw it directly, but if it makes it easier for you, draw a flat skeleton, lay it over, and then fill it in with the colors you like to identify each individual muscle. Does that make sense? Or we could actually do it together. Okay, so I'm going to change this color. Everyone knows how to change colors. You press the up button. This is heating up. Thank you. Is there like a white material? Oh, okay. Oh, that's hers. Oh, thank you.
And
Uh-huh.
yeah, I don't think I brought much of the way.
Okay. Okay.
I think there's some light colored filament, or like a light brown,
Okay.
that you guys should use as well.
Yes, it's the plantar aspect. And if you're familiar with your foot, it attaches from the medial and lateral calcaneal tubercles. That's the origin of the top two, medial and lateral calcaneal tubercles. And then it's going to attach to this long flexor tendon and draw out your tendons to reach the tips of each of the toes. And then the lumbricals actually originate from the long tendon and insert to the proximal, to the metatarsal phalangeal joints. Well, they insert at the bottom of each toe. Okay, so I'm going to start by drawing out the long tendon first. Okay, so
And to save time, if you want to just use the same color that you have, we could do that because we're getting a little close on time.
Oh, okay. Oh, be sure to make this fast. However, this is not heating up. Thank you. Okay. All right.
So this is really a new process. None of us are even used to these pins very much often. But if there's any ideas that you guys have as far as what might be a better way to do this, or you have another idea for another project, there's going to be, we have a plan in one of the classes. They're going to do something very similar to what you're doing now with the foot bones. And then they're also going to do knee structure and show and draw in some of the muscles and stuff in that area as well. Keep in mind that we're showing you one type of use for it. We're hoping that you guys will come up with others as well, with perhaps a different model that may be more pertinent to what you want to show.